Hi, in this video I'm going to share a few top tips for how to get in and out of bed when you've got acute back pain or sciatica. We see a lot of our patients at the clinic that struggle to get in and out of bed, and sometimes you can be doing more harm than good struggling. So we thought we'd show you a few simple tips that can help. So the first thing to consider is how we get into the bed. So when we've got a very painful back and or sciatica, movement is very difficult. So one of the first things we want to do is just move to the edge of the bed and then lower ourselves down gently. So we just get into a position slowly. Now what we want to do is avoid twisting movements through the spine and rotation through the spine, because when you have spinal disc injuries or facet joint problems or sciatica, it can be extremely painful when we move, even small amounts. So we want to limit that. So the safest way to lie down to start with is to go into a side lying position. And the way we do this is we just gently, as the legs swing up, we then move to our side and transition onto our side, but we'll use our hand and our elbow to support us. So it looks a little bit like this. So as we go to lie down, we just put our hands here as the legs swing up, and then we slowly lower ourselves down into a side lying position. Now, depending on the nature of your problem, side lying might be comfortable. If it is, then we recommend taking a pillow and just placing that between the knees. Now, the beauty of this is it relaxes the upper hip. It also helps to keep the pelvis straight, and it stops too much twisting through the spine. So when you're lying on your side in this position, it can be quite helpful if you've got a very painful back. If, however, you have sciatica, let's say you have pain in the buttock and the back of the thigh and the calf and the foot, and that's causing you a great deal of pain, you may actually find if you put a support under the opposite side. So if you have sciatic pain down your right leg, we want to put a support on the left-hand side of your spine to open up the spine and take some pressure off the nerves. So it would look a little bit like this. So we just come up just for the moment, remove this. We'll then take another pillow and we'll roll this to form a bolster. So this is going to go under the side, the opposite side to your leg pain. Okay, so if you have right leg pain, it goes under the left hand side, and if you have left leg pain, it goes under the right hand side. So we would take our two pillows and we place this one like so. We bring this one in between our knees, and then we can lie in this position. Now this can be really quite comfortable if you've got that horrible constant nerve pain down the leg, because as this opens up the spine here, it takes some pressure off. So this is quite useful. Now, if you can't lie on your side, the next recommendation, we still use pillows, so I'll remove this for the moment. Now, to come up, I'll show you how to come up from a side lying position. This is the safest way to get out of bed anyway. So as the legs lower down, we put pressure with the elbow and the hand, and we slowly walk the hands along the side of the bed to sit up. Okay, you'll see me do that again in a moment. So I'm going to remove the pillows. So the first thing we're going to do is we're going to go back into our side lying position. So remember, the hands help to lower us down as we lift the legs up. The legs are very heavy, so they pull on the back. When you have an acute pain in your back from a disc injury or some other underlying problem, it can be extremely painful. So you can use the legs, or rather you can pull on your pajama trousers or whatever you're wearing to help you move your position. So what we recommend for the next position is to slowly inch our way round, lift this leg up slowly into position, and then bring this leg round as well, trying to avoid too much of a twist through the spine. Now, once we're in this position, to aid support and to take pressure off the low back, we then place a couple of pillows under the knees. You might need some help with this, of course, if you're in a lot of pain. So try and get the pillows. It's not a precise science, but try and get the pillows under the knees, and then you can lie on your back. Now in this position, we're relaxing the back, we're relaxing the hips. Okay, so you might find you can't sleep in this position, because if you're a side sleeper, you can at least get some rest and you're taking pressure off those painful structures. Or you might find, if you're a side sleeper and you go onto your side with a pillow between your knees, or you have a pillow between your knees and something under either the left side or the right side to take the pressure off your sciatic pain, you may well find you get more rest. Okay, so I'll just give you a little demonstration again of how to get up safely. So we discard our pillows, just pop those over there. Now we're going to slowly bring both legs up. If you need to, grab hold of your pajamas or whatever you're wearing. Slowly inch round, and then we're going to come round onto our side. And if you're in a lot of pain, this is going to take a few minutes. You're not going to be able to rush at this, because you're going to have to go in your own time, but it's the kindest way to get up. So from here, we have an elbow here, we have a hand here. As the legs lower off the side, we walk our hands along the side of the mattress until we're in a position to sit. If need be, if you're in a lot of pain, you'll be bracing yourself on your hands. I've been there. And then gently inch forwards on the mattress. And then once you feel able to, if need be, you can place your hands on your legs, or just push up gently until you get to standing. Once you get to standing, just give it a few moments, don't rush, and then you can just start to just gently mobilize the spine a little bit before you then start to move. Okay, I hope this has been of some help. Thanks for watching.